Dr. Mencia.
Hi, good afternoon. Thank you very much, Mr. MC. Thank you very much, Dr. Henry, for a fantastic opening presentation. I'd also like to thank TAP, particularly Michelle and Mei Ling, who have done a great job in putting on this expo. This is the best I've seen in Trinidad since I've been back. It certainly looks like the United States. So thank you much, everybody. You did a fantastic job. As the MC was saying, I'm a UWI graduate and I lecture at the university. My area really, subspecialty is hip and knee pathology, in particular osteoarthritis. But the talk today is not going to be osteoarthritis. I'm going to speak about another condition, one that you could prevent and one that is potentially as deadly as what Dr. Henry was speaking about. He's speaking about osteoporosis and really what happens when one falls. I've been a little bit put on the back foot because I thought we'd have an audiovisual presentation. So I had my slides, and unfortunately I am not as articulate as Dr. Henry. So I can't ad-lib, and I'll have to use this to help me along. So I ask you to bear with me, please. Before I start, by a show of hands, can I see how many people here have fallen down in the last year? Right, okay. How many people fell in the last 6 months? All right. How many people have fallen multiple times in the last year? A couple. So the point is we have a captive audience. We are falling down, and falling down is not really a good thing to happen. It's an accidental, impact with the earth. But we have people that fall regularly and it doesn't cause a problem. And we know them, they're babies. Babies fall, nobody has a problem, they cry, they get back up. The young adult falls, and when they fall, they also get back up. They don't sustain as many injuries as the older patient. When the older patient falls, it can be a catastrophe. You'd be familiar with an older patient falling, and where do they fall? They don't fall in here, generally speaking. They don't fall in the parks. They fall in their houses. And where in the house do they fall? The bedroom and the bathroom. Those are two very dangerous places to be as an older person. And when they fall, they get great difficulty getting back up. They fall flat on their face, generally speaking. If you and I fall, you'll fall in such a way that you can get yourself back up. But the older patient falls flat down, there's nobody to call, and they can't get back up. Well, that is a terrible thing to happen, generally speaking. But what is worse than that is that they sustain injuries. And injuries I'd like to talk to you about really are the musculoskeletal injuries, in particular the fractures. But before we do that, let me just talk about some statistics. It is said that about 10 to 15% of all accident and emergency admissions are due to falls. So those are patients presenting to the A&E department that require admission. That is about 1/5 of the patients who actually come to the accident emergency department and are discharged. So it is sufficient to say that falling is a very common problem, and we have to do something to try to prevent it. What are the causes of admission? Well, the main causes are upper limb injuries. You fall, you sprain your wrist, you break your wrist. Traumatic brain injuries. Sometimes you get actually a bleed within the brain. But again, the one I'm going to talk to you about here are really the hip fractures, which is what we want to chat about a little bit. Some more statistics. As we get older, our risk of falling increases. That's a fact. And as we approach 80 years old, as our last question from the audience, your risk is actually almost 3 times what you'll get as when you are 40 years old. So you are likely to fall. And when you fall, you are likely to sustain a fracture. So in the audience here, I'm seeing mostly women, and this is the group that sustains the fractures. But if men think they are somehow escape it, no, they don't. Actually, as you get older, the risk of falling increases. As you get older, the risk of dying because of a fracture also increases. But worse for men, compared to females of the same age, your risk of dying is actually greater. So in other words, men fall as they get older, and they're more likely to die if they break their hips. So this is a problem. This is actually a public health problem, very similar to hypertension and diabetes. We're speaking about falls and the fractures. For you to sustain a fracture, you have to have two things. One is just you should fall, and we're going to talk about preventing falls. And two, you must have weak bones, and that's the osteoporosis we're going to talk about. Anybody knows what's the name for the fractures that somebody sustains when they have weak bones? Any audience? The osteoporotic type fractures. We talk about brittle bones. You may have heard about it. That means your bones are unlikely to sustain or absorb the energy impact on falling. When you fall, they don't bend like the younger patient. They actually break. So those are brittle bones. And where would you sustain those fractures? Well, there are four areas. One is your spine, and we'll talk about that in a second. The second most common is the wrist. That's called the Colles fractures. Third is the humerus, and fourth is the hip. Think about this. You're an older patient, older person, you try to fall. You have the ability to put out your hand to break the fall, but you break your wrist instead. As you get older and your ability to protect yourself gets less, you fall, but you can't even put out your hand. You fall on your shoulder. So you sustain a fracture here. Worse than that, as you get older again, and your ability to protect yourself decreases further, you can't even put your shoulder, you fall wrap on your hip, and your hip breaks. So these fractures are really a continuum of a deteriorating state of health and one's ability to protect oneself. There's one fracture that I haven't mentioned, the spine. How do you sustain that fracture? Well, it doesn't come from a fall, generally speaking. It's an insidious onset, and we know it. How do we know it? Because we see patients walking around with it. As a young person, you stand erect and you're walking around. As you get older, you tend to bend forward. And we see the older patient almost looking at the ground. And why? I say stand erect. They can't stand erect because their vertebra in the spine has collapsed. The front has wedged down, and they are looking like this. And anybody who is in the golden years of age, who is bent forward, has an osteoporotic fracture of their spine. Okay? And we make jokes sometimes, call them bossy back and so forth, but that is a fracture. You have osteoporosis. So without even testing, we can tell. I mentioned already what osteoporosis is, and that is the weakening of the bone, the brittleness of the bone. But there's another term that comes up and it's confused a little bit, and that's osteoarthritis. Now, we're not here to talk about osteoarthritis, we're talking about osteoporosis. Osteoporosis is the bone being weak. Osteoarthritis is the cartilage deteriorating around the bone. Two different conditions, treated differently, different symptoms. Osteoarthritis does not cause fractures. Osteoporosis does. Osteoarthritis is treated by replacing the joint. Osteoporosis is not. Okay? So those are two terms I'd like you to take home. So who gets osteoporosis? We've been classically told it's the elderly, female, fair-skinned person. But in Trinidad, I can tell you that osteoporosis is prevalent even in the dark-skinned people. It is certainly more common in fair-skinned, lighter weight females. But we have it. So your skin color is not going to protect you from osteoporosis. I mentioned before that how do you know if you have osteoporosis? Well, if you're bent forward you have osteoporosis. If you have sustained one of those fragility fractures, wrist fracture, shoulder or hip fracture, you have osteoporosis. But osteoporosis is very similar to diabetes and hypertension. How do you know if you have diabetes or hypertension? People will say, I have a headache, so my pressure is high. I used to hear that if you pass urine and ants follow the urine, you have diabetes. I think all those things are old wives' tales. You have to test for it. Without testing for your diabetes or high blood pressure, you do not know if you have it. Osteoporosis is the same in that manner. There's a test for it. It's a DEXA scan, and it will give you a figure, a number, which will tell you what your bone mineral density is for your age, right? And for a person younger than you across the normal population. You get two scores, a T and a Z score. So you will know how you compare to somebody of your own age, as well as compared to another person who's about 30 years of age. And those are important figures to know, almost as important as your blood pressure and your blood glucose levels. How do you treat osteoporosis? Well, I'm not here to tell you the whole gambit of treatment. Simple treatment. Well, calcium, vitamin D, it's not enough to be in the sunlight. We think we're in the Caribbean, you get a lot of sun. Most of us are well covered here. So even if you're going to the sunlight, you're not going to get enough. So supplementation with calcium, vitamin D, the older patient just doesn't eat enough. You need to be supplemented. There's also exercise. As Dr. Henry was saying, you need to exercise for your heart, but you also need to exercise for your bones and your muscle. Type of exercise, generally, weight-bearing exercise. Swimming, not so good. Cycling, not so good. Walking, fantastic. Going to the gym, fantastic. All those things are going to maintain your muscle, build your muscle mass. And the last thing, of course, is bisphosphonates. And similarly to what was said earlier about statins, I've heard the whole gambit about bisphosphonates. It's going to cause this, it's going to cause that. Well, one thing for sure, bisphosphonates are likely to decrease the rate at which you're losing bone and possibly prevent you from having a fracture, which could save your life. So bisphosphonates and statins have a similarity. Why do elderly people fall? There are 4 factors put forward: biological risk factors, behavioral risk factors, environmental, and socioeconomic. So we're going to talk about some biological risk factors. And there are 3 things. One is age, gender, and race. And these are non-modifiable. We cannot change our age, or gender, or our race. That's what we've been given. It's out of our control. So suffice it to say that your gender, female genders, have a higher risk of falling compared with men. Your race, we know that the Caucasians fall more often than, for example, the Chinese. Why? We're not quite sure. But that is a fact. What about some modifiable risk factors? Well, physical strength. The stronger you are, the more likely you are to resist a fall. That seems sensible. And what about things that you can do to help you? Well, Dr. Henry spoke about that walk. Here I have to walk again, 30 to 45 minutes. And I'm talking also about another type of exercise which might be not familiar to you. It's called Tai Chi. And Tai Chi is about balance. We have aquatic therapy, balance training, gait training in the water. Extremely important. As you get older, you lose the ability to maintain your space. You tend to fall. If you don't work on balance, as you would work on your muscles, this causes you to fall. So balance training is important. People who have a lower chance of falling tend to be voracious readers. They're not in their house quietly in a corner. They're reading a book rather than watching TV. And they're socially active. So by extension, top members would probably have a lower risk of falling than the general population. Here you are all gathered together with a common goal. You're interested in your health. So those are things that exist. Those are biological factors. What about behavioral things? What can you do that will cause you to fall? I have here alcohol abuse. We tend to associate alcohol with the younger patient, but the older patient can abuse alcohol, particularly the men, in my experience. But what is more common really is polypharmacy, using many drugs all at the same time. I've commonly asked patients to show me what they're taking. And when they open their bags, the women, they would have the same drug, 3 different names, and they're taking all 3. And added to that is the fake news, the herbal therapies outside there, which could cure cancer, cure diabetes, cure hypertension. That combination can be problematic, you know. So using those things are likely to lead you to some problems. I have 2 behavioral risk factors which I think are specific to our people. One is the use of step ladders. Why does the older patient go up on a step ladder? I don't know. There is no need to go on a step ladder. That is responsible for more falls than you could imagine. Step ladders are for a younger person. And the other one happens right now. In mango season, you tend to want to pick the mango. Leave those mangoes for the neighbor. Let them pick it and bring it for you. The minute you look up to pick the mango, you overbalance, you fall, that's going to be a problem. So picking the mangoes, picking the zabuka, I think those need to be left out. Environmental risk factors, your environment. Probably one of the most dangerous environments is actually your house. And that should be one of your safest environments. Why is the house so dangerous? The things you have in your house, older patients, older people tend to keep a lot of things cluttered around the house. One of them are things like this, carpets and mats. You always have one somewhere. They develop little rocks in it, and you trip over the rock and you fall. So my suggestion is to get rid of all of those things. That is a disaster waiting to happen. What about the bathroom? The bathroom floor is always clean and shiny, and you're likely to slip inside of there. So the bathroom needs to be equipped with anti-slip flooring. In the shower, you need to have grab rails, because these things can prevent you from falling, and if you're going to fall, can prevent you from hitting the ground. So bathroom is one. And what about lighting? The dimmest lights tend to be present in the houses. You need proper lighting. Your eyesight is failing. There's no need to have a dim light. Put the 100 watt on. You need to see what's going on. Those lampshades are only casting shadows. If you see properly in the house, you're unlikely to fall. And my personal favorite is pets. In England, the pet or the animal responsible for most fall in the elderly patient was a pigeon. You want to feed the pigeons. As you throw something to feed the pigeons, everybody goes up in the air. You fall back, and that is the end of that. In Trinidad, one of the most deadly animals really is your dog. You know, they're all on the ground, they're all on your feet with a leash, they trap you up off your fall. So I'm not suggesting you get rid of the dog. I'm suggesting you be careful with the dog. The dog is going to trip you up. Last really are the socio-economic risk factors that predispose to falls. And when I say this, I mean that people in a lower socioeconomic class have less access to healthcare. They are socially isolated. You know, they do not have the economic means, despite CDAP sometimes, to access the care that they need. That is a vicious cycle. And that is a very common cause of patients feeling neglected, abandoned, and falling. And I have, again, experienced that when patients fall and they break their hip, finding family members is hard. So they are isolated. So trying to, that group is a special group in society for us. Last but not least, really, I've spoken about trying to prevent falls. I've spoken about osteoporosis. Falls osteoporosis equals a fracture. I'm going to speak about the hip fracture. As you get older, falls increase, fractures increase, hip fractures increase. Twice as many females break their hips as males. But if a male falls, he's more likely to die if he fractures his hip. Hip fractures are more common in fair-skinned people than dark-skinned people, but we are not exempt. 80 years old is the threshold. As you reach 80, your mortality from a hip fracture increases. So this is a serious problem. What exactly is the mortality I'm talking about? What is the risk of dying? So you're unlikely to die from the fracture itself, but in the year following a fracture, in 12 months following a fracture, about 30% of people will die. So that is 3 in 10 of the patients who sustain a fracture are going to demise in 12 months. That's a significant amount of patients who are going to die. And I can tell you that very few of them will ever get back the ability to walk normally after that. And the reason to avoid hip fractures, if I haven't convinced you, one is pain. They are bloody painful. You can't move. You're in a mess. So they're extremely painful. 2, they're also costly. You know, they're costly not only in dollars and cents, but they're costly also in a social sense to us. You know, if you sustain a fracture, you're going to need care. And that care is going to have to come from family members who are going to have to take time off from work, maybe employ other people. So it's an expensive little thing to society to sustain a hip fracture. 3, the ability to walk again. We have a little saying that if you break your hip and you weren't using anything to walk, you're going to use a walking stick. If you break your hip using a walking stick, you're going to have a walker, or one of those frames to walk with. And if you happen to break your hip while you're using a walker, you're probably going to be in a wheelchair. So your ability to walk decreases over time. And last but not least really is the mortality. 30% of patients will die within 12 months of sustaining a hip fracture. There are 2 types of operations for hip fractures. One is you will replace the hip and you throw away the head because the blood supply is affected. And the second one is when you fix the hip. That is of importance really to the surgeon, not so much to the patient. Both of them have very similar outcomes, either way. They're both going to lead to a decreasing ability of you to walk around, enjoy life. So my parting advice, prevent falling. Do what you can. Exercise more, check your bone density, have treatment. Osteoporosis is a real problem. It is like diabetes and hypertension. It needs to be assessed. But most of all, go out there, enjoy life. You've reached the age where life is to be enjoyed. There's probably more behind than in front, as they say. So you need to enjoy life. You need to enjoy it in a safe environment. So exercise, exercise, exercise. That is my advice. Thank you very much.
Is there any particular reason that women tend to fall more than men?
That is just some statistics that we get globally, that women fall more than men. Why women break their hips or the bones more than men has to do really with their bone density and the ability to prevent themselves or protect themselves from falling. You know? But I don't know exactly why.
Yes, again, you know, I'm interested about cramps, about the body. Fingers cramping up. You know, you at mornings when you get up and you want to stretch out, you just wake up, your leg is cramping and things like that. And can you enlighten us on the causes?
Right. The question is cramps. There are 2 types of cramps really. One is the one that they talk about when you lose your electrolytes, or runners and so forth. Athletes, they have electrolyte imbalances. The cramps that we more commonly sustain rarely occurs when you do too much exercise and your muscle is unaccustomed to it, right? Or two, when you have not done exercise at all and you're in an awkward position. So when you wake up in the morning and you feel a cramp, it's because the position that your leg or your arm was in was awkward. And as you try to move off, the muscle reflexively contracts. And that's the kind of cramp you're experiencing. And that is simply treated by stretching the muscle more or less. You can't prevent it as far as I'm aware. So none of these drugs that people recommend is helpful for those sort of things. It's a matter of stretching out the muscle in the mornings.
Two quick ones relating to why is it men, you say, die more often, and why within a year after they fall, someone is likely to die?
Okay, good questions. Well, I don't know exactly why men have a higher mortality rate. These are just statistical studies. They've looked at patients who have fallen, male and female, who've sustained a hip fracture. And men have a higher rate of mortality. I'll tell you why they die. What I forgot to say in my presentation is that as you get older, your medical comorbidities increase. When I say that, you're more likely to have diabetes, high blood pressure, heart disease, kidney disease. So the fracture does not kill you. Actually, the fracture is a sign that generally your body is deteriorating. So when you fall and your ability to move further decreases, those medical comorbidities get worse. So you die from things like a pneumonia, a deep vein thrombosis, a stroke, and that's why I die within that year. So my last point was that you have to keep moving. The minute you fall and break anything and you stay still, bad things happen. So move really is a mantra in that sense. Exercise is a good thing. And I think walking really is probably the best exercise, but it doesn't do anything for your upper limbs. So weight training is also an important part, because as you train your muscles, your bones also are stimulated. So I suggest that you weight train, Tai Chi, and walking to be the important exercise. Thank you very much, everybody. You've been a great audience.